Welcome, friends. Namaste. Did you know that 50 to 75% of Americans aren't meeting their daily magnesium needs, with 19% consuming less than half of what's recommended by the government? So, today we are kicking off the video series on this remarkable mineral, magnesium, in response to high demand from all of you. In this series, we will delve into who these magnesium deficient individuals are, pinpointing 4 groups that might be at the lowest magnesium level. Be sure you don't belong to one of these 4 groups. Plus, we'll unveil the top 5 richest sources of magnesium that can transform your health. So, let's embark on this enlightening magnesium journey together. This is Dr. BINAY Kumar, a triple board certified MD, and I'm your host today. As we saw, up to 75% of people may have magnesium deficiency. And what's even more concerning is that since 1940, the magnesium content in 72 fundamental foods have decreased by about 21%. So, you can imagine what's going to happen in next few decades. This decline in magnesium level is not unique to United States, but it is observed across several continents. It's worth noting that these statistics are based on RDA, recommended daily allowance, that many medical professionals believe is set too low. And if you are older than 70 years or an adolescent 14 to 18 years old, then magnesium deficiency is even more common. To maintain electrical rhythm of your heart, you need optimum level of magnesium, because low magnesium increases the odds of cardiac arrhythmias. Unfortunately, many times cardiac rhythm problems can result in sudden cardiac arrest and can be instantly deadly. Some of you may have heart palpitations, in which you feel your heart rate is abnormal and often uncomfortable. Many times it is due to what doctors call premature ventricular contraction, in short PVC. And people who have low magnesium level, as you saw, which is almost everyone, has 2 times the odds of having PVC, as shown in a Canadian study involving patients who are obese and diabetic. Not only that this magnesium deficiency makes your blood pressure go up, but can give you diabetes, debilitating painful headaches known as migraine, and can also make you age faster. But why magnesium deficiency is causing so many problems? That's the question. Well, my friends, magnesium is an essential mineral that is involved in energy production, nervous system function, blood pressure regulation, and blood sugar control. Not only that, optimum bone formation and many more functions. In fact, the role of magnesium is so pervasive that it wouldn't be a surprise for you to learn that optimum magnesium level is needed for about 300 to 400 different types of life-sustaining chemical reactions in our body. Population data finding supports association between low magnesium level and higher risk of sudden cardiac death. Let's take a look at this prestigious Harvard nursing study that followed about 88,375 disease-free women for next 26 years. The study found that each 0.25 milligram per deciliter increment in plasma magnesium was associated with 41% lower risk of sudden cardiac death. Other studies have reported similar findings. So it is clear that magnesium plays a crucial role in heart health, and we cannot ignore these findings. Magnesium is found in abundance in whole grains, leafy greens, vegetables, legumes such as beans, peas, lentils, soy, nuts, and seeds. Now, you might be wondering about the top 5 foods that are richest in magnesium. Here they are. Pumpkin seeds. Just 1 ounce of pumpkin seeds provides nearly 150 milligram of magnesium. Spinach. 1 cup of cooked spinach contains approximately 157 milligram of magnesium. Almonds. Almonds are a delicious and convenient way to increase your magnesium intake. 1 ounce of almonds offer around 76 milligram of magnesium. Everybody's favorite, avocado. 1 medium-sized avocado provides about 58 milligram of magnesium. Last but not the least, dark chocolate, also cocoa, cacao, from which dark chocolate is made. Yes, you have heard that right. 1 ounce of dark chocolate typically contains about 65 milligram of magnesium. Among the top functions of magnesium is energy production, also called ATP. For those who may not be aware, just as the dollar is the world currency, ATP is the energy currency of every animal body. When you wake up, your ATP storage is full, and during the day, you spend it all. By bedtime, your ATP levels are at their lowest. Without ATP, even blinking your eyes is impossible. So you get the idea. It's no wonder that the earliest signs of low magnesium include weakness, fatigue, and nausea, vomiting, and loss of appetite. As the deficiency becomes more severe, it can lead to tremors, muscle spasms, and even cardiac arrhythmias, and even seizures. But who are the people who may have such severe magnesium deficiency? The most severe magnesium deficiency often occurs in 4 different scenarios. People with a history of alcohol use, the booze, people taking antacids, especially PPI class of antacids like omeprazole, Prilosec, Nexium, Protonix, etc. Individuals with gastrointestinal problems, for example diarrhea from inflammatory bowel diseases, Crohn's disease, ulcerative colitis, celiac disease, and those taking water pills like hydrochlorothiazide, furosemide, Lasix. Many of you may feel concerned about hearing all of this and may find yourself in one of the scenarios described above. And you are probably eager to find a solution. Well, we already discussed the top 5 magnesium-rich foods above: pumpkin seeds, spinach, almond, avocado, dark chocolate, cocoa, cacao. Now, let's look at this study published in American Journal of Clinical Nutrition involving healthy women over 65 years old. Their weekly exercise capacity improved after a 12-week program with just 300 milligrams of magnesium oxide supplementation. Even in patients with normal magnesium level, this suggests that the so-called normal magnesium levels may not necessarily be optimal. On the topic of exercise, magnesium supplementation has also been shown to reduce delayed onset muscle soreness in athletes after heavy workouts. So, addressing magnesium deficiency or suboptimal levels could potentially benefit not only your overall health but also your exercise performance and recovery. So, in summary, magnesium deficiency is a widespread concern affecting a significant portion of the population, with many falling short of their magnesium requirements. This deficiency can lead to various health issues, including fatigue due to magnesium's role in ATP production, the body's energy source, and magnesium supplementation showed increased exercise capacity. Low magnesium levels have also been associated with increased risk of sudden cardiac death, as magnesium is vital for numerous essential chemical reactions in the body. Harvard's nursing study demonstrated that even a slight increase in magnesium level can reduce the risk of sudden cardiac death by 41%. The top 5 sources of magnesium include pumpkin seeds, spinach, almonds, avocados, dark chocolate, with a preference for high plant-based sources. 4 high-risk groups for severe magnesium deficiency include people with a history of alcohol use, those taking antacids, especially PPIs, people with gastrointestinal issues such as diarrhea from Crohn's disease or ulcerative colitis, and those using water pills like hydrochlorothiazide. I will end the video with 2 important cautions to remember. Exercise caution when taking magnesium supplements. Ensure a minimum 4-hour gap from other medications, and avoid excessive magnesium intake as it can have serious consequences. Always consult your healthcare provider for personalized magnesium guidance. If you need further assistance, use the link provided in the description below. Join our Happy Health Warriors, a family of thousands of people who have turned around their health. Click the link in the description to book a consultation. My specialties are reversing age by up to 14 years, women's hormones, dementia reversal, and holistic weight loss. Also, pre-book our hypertension reversal course now to secure the lowest price before the price doubles after release. I will not only help you achieve hypertension-free health, but also guide you every step of the way. Stay blessed. Namaste. Adios. Zaizan. Khuda Hafiz. Alvida.